All right, January is Cervical Cancer Awareness Month, and a recent study found that advanced stage cervical cancer is rising in America.
And Dr. John Schwerkoske, an oncologist for the Oncology Institute in San Diego, is joining us now to tell us just a little bit more about these findings. Doctor, thank you for joining us. Happy New Year.
Happy New Year to you guys.
Tell us a little bit about what they're seeing and why stage 4 cervical cancer cases are on the rise.
So I think we're trying to look at a lot of different things. I think testing during the pandemic was a challenge, so we're definitely looking into that as a possible cause. And also, the vaccine about 10 to 15 years ago was newer, and now it's not as new. And so it's something that we're looking at, are people getting vaccinated and how are we screening?
So what are some signs that somebody might have cervical cancer? What do they need to look out for and be aware of?
So early stage and late stage are very different. Early stage, we're going to see things like local symptoms. So bleeding between periods for younger women, older women, bleeding postmenopausally at all needs to be worked up. That's always abnormal. For later stage disease, it's abdominal pain symptoms regarding the GI tract and urinary symptoms.
What are the best ways, I guess, to actually prevent it? I mean, what can we do? Is there anything?
So there's a vaccine, and our pediatric patients are the ones we're really wanting to focus on there. We should really be talking to our kids age 9, 10, 11. The FDA has this approved for them, and before exposure to the virus that we know, the HPV virus that causes this cancer in most cases.
And it's a 3 series, isn't it?
Yeah, it's variable depending on which one you get, but 2 to 3, yeah.
What about treatment? What are the treatment options for cervical cancer?
So treatment options are variable. Our early stage disease can be treated locally with more surgical-based techniques. More advanced stages, you're going to use chemo, radiation. But at the Oncology Institute, we kind of work on a multidisciplinary approach with all those treating specialists to develop a personalized care plan. Later stage disease, we have immunotherapies that are available as well.
But it's really about getting screened, isn't it? Like really
Absolutely.
Checking and getting your annual exams and things like that. It's just so important.
Very critical, yes. Because this is almost 100% preventable with appropriate screening.
What is the age group that you generally see cervical cancer in?
So, it can happen almost at any age group. Before 25, we don't recommend screening as much, but there is an increasing incidence in the 30 to 34-year-old population, so younger women need to be very conscious of screening. And then, of course, later in life, it's still a risk.
There are clinical trials as well. Are there pros and cons to those, or even giving those a try?
Yeah, absolutely. Clinical trials are good. Usually for later stage disease, we have a few that are open at different sites, and so it's definitely something to talk to your oncologist about and others.
All right.
Important warnings. John, thank you very much. Doctor, appreciate the insight. One of those things that a lot of people need a lot of information on, and the more aware we are, the better, certainly.
Absolutely.
Definitely.
Thank you so
much.
much.
All right, thanks for coming in.